So believe it or not, there are medications available for kids to use for weight loss. Now, most of them is after the age of 12. And semaglutide or Wegovy was approved for after the age of 12 for weight loss. Orlistat as well, liraglutide as well, and Qsimia. So liraglutide is in the family of your semaglutides, Ozempics, Wegovy, etc. It is a GLP-1. Is not as strong as Wegovy or Ozempic, for example, but it is still effective. So that's liraglutide. Semaglutide or Wegovy, pretty much everybody knows what it is. It is very effective. It's a once-a-week injectable. In difference to the liraglutide is a once-a-day injection, which tends to be inconvenient, especially if you're giving a kid, this. So now that Wegovy was approved for pediatric use after the age of 12, pretty much most people are going to that option versus liraglutide. Qsimia is a mixture of topiramate and phentermine. So essentially, phentermine, it is a stimulant. It's kind of similar to Adderall. Kids that get on Adderall really don't eat much. It's basically the same concept. So side effects is tachycardia, dry mouth, insomnia. So it can affect kids the same, but it is a much lower dose than just regular phentermine, so it tends to be tolerated better. And then when it's combined with topiramate, it essentially accentuates the appetite suppressant effect, and it does mitigate some of the side effects from phentermine as well, particularly the insomnia. Orlistat, as I said in one of my previous videos, it is essentially a fat blocker. So it is a little bit embarrassing to take because a lot of people have accidents, like rear end stool accidents, with the side effect being diarrhea. So that's probably not the best option for a kid. Also, it's a daily administration, so with kids, compliance is an issue. So I'd probably gear more towards the once-a-week injections like semaglutide. Zepbound is not approved for pediatric use just yet. I did see some clinical trials that it's being looked into, but it has not passed as of yet. And then there is one more medication approved for weight loss for kids after the age of 6, and it's setmelanotide. But it is for obesity related to a genetic disorder. There are various genetic disorders that exist that with this medication, and essentially treats it because it works in the area that's basically malfunctioning. And I'll do another video in the future about that because it's a little bit complex. But those are basically the options that are available for children. The best thing is dieting and exercise. A lot of kids are indoors nowadays, watching TV, watching video games. They don't do much sports anymore. So getting outside, getting some fresh air, get moving, it's always the best thing. And also having healthy options at home. And I know it's difficult because, a lot of us are working. So it's difficult to get out of work and then, cook a meal. A good healthy meal. It's faster to just go through the drive-through, but it is what's best for the children. So that's pretty much it on medications for weight loss that are approved for children.